Did you know that clinical depression in the elderly is so common that it affects approximately 6 million Americans age 65 and older? Unfortunately, only 10% of these individuals receive treatment for their depression. Joining me is Dr. David Baker Hargrove to talk about the causes, symptoms, and treatments of depression in older adults. Welcome, Dr. Hargrove.
Thank you for having me.
Now tell me, what are some of the causes of depression in older adults?
Well, there can be a lot of different reasons. Sometimes I think, we aspire to kind of get to this place in life where we get to retirement and we have the idyllic existence and that we're through with work and all of those kinds of things. But what we don't realize is that all of the work that we put into family and our jobs and everything all along the years gives us a purpose.
Yes.
And so one of the problems that when we're older and retired and we lack a sense of purpose in terms of what we're doing in our lives, and we have to really kind of reconnect with what later in life means to us and how to have a purpose after work, after raising a family, and doing those kinds of things.
What are some of the biggest concerns regarding depression with the elderly?
Some of the biggest concerns is that a lot of times it's overlooked by medical doctors. We just assume that as people get older, that they're going to become more sedentary, that they're going to become less interested in life, that they're not going to have the same kind of passion for things that they had when they were younger, because of course, work and family, raising children take a lot of our energy.
Yes.
And so medical doctors will automatically assume that now that all of those things are gone, that you're going to be left with sort of a sedentary person who sits around and watches game shows all day. And so they may be dismissive of symptoms or things that people are going through and not really recognize them. And so it's important for people who are elderly to recognize in themselves and know what they need to be looking for.
Well, what should you be looking for, not only in yourself, but in your friends?
Definitely a loss of interest in activities, especially things that you used to enjoy doing. Also, don't underestimate like a sad or depressed mood. We all can get blue sometimes, but depression is really more about a continuous mood that doesn't lift or doesn't shift, and not really interested in doing things and finding it hard to engage in life. It's extremely important as we age to continue to engage in life.
What about physical conditions and depression?
Well, here's the interesting thing. Depression and anxiety can have a lot of physical manifestations to it. I always tell clients that the body will absorb what the mind refuses to deal with. And so, and a lot of those can be mistaken for physical maladies. So we can have physical complaints in the digestive system, muscle aches, joint pains, all of those kinds of things. And then when we go to the medical doctor and we talk about these symptoms that we're experiencing, the medical doctor is going to try to look for some physical reason for it. And sometimes if it is depression, they may say, oh, well, it's just a part of getting old. And, go back home and do something useful with yourself.
Mm-hmm.
And so, and just not really recognizing that it is, in fact, can be depression. So we have to really take into account what our body is telling us as well.
How do you talk to an elderly family member who you think might be exhibiting symptoms of depression or anxiety?
Well, what I would recommend to people is that first thing you have to initiate the conversation and you have to ask point blank in terms of if there's a concern, you have to be able to initiate that discussion. Now, here's the tricky part. I'm 51 years old, my parents are elderly, I'm still in a hard, it's still not easy for me to talk to my parents about personal stuff that's going on in their lives, even though now, as they get older, our roles may begin to shift. Mm-hmm. And it's really hard to kind of change that dynamic. So as the adult child of a parent, or elderly family member, you have to be patient with yourself to continue to initiate that discussion and not just say, so if it happens one time and your dad or your mom doesn't really want to talk to you about it, that doesn't necessarily mean the discussion is over. You want to gently try to continue to initiate the discussion, to continue to talk to them. Again, it's also important to realize that people who are 75 and older did not come from a generation where you talk about a lot of stuff.
And I'm afraid we're going to have to stop right now, but thank you very much for these comments. They've given me some insight. Thank you.
All right, thank you for having me.
Dr. Baker Hargrove certainly has empowered me to continue reaching out to friends and family members who may be suffering with depression.